There are many challenging aspects of stroke recovery, and spasticity is one of the worst. Hi, I'm Elise. I hold a clinical doctorate in occupational therapy, and I'm also a certified stroke rehab specialist. While we can't reverse spasticity, the good news is that we can help to reduce it, keep your muscles lengthened, and prevent contractures from forming using 5 simple techniques. None of these techniques require any special tools or equipment, and they can be safely done at home. All right, let's get into it. Technique number 1, prolonged stretching. Of course, you always want to check with your doctor or therapist before starting any new exercise or therapy routine. Now, this technique is one that I really love. This is doing slow, gentle, long stretches that give spastic muscles time to relax. Now, there isn't research that shows that prolonged stretching helps over the long term, but in the short term, it can help to reduce your spasticity on a day-to-day basis. And by giving those tight, stiff muscles a chance to relax, it can also make them temporarily feel a bit more comfortable. And that daily stretching is an active way to help prevent contractures from forming, which is a permanent shortening of tendons and muscles that we do not want to happen. The evidence on prolonged stretching is pretty varied, and it's not super clear as far as duration and frequency, so how often and how long you should be doing it. Now, my recommendation is to shoot for around 1 to 3 sets daily of 2 to 3 repetitions. And for each stretch that you're doing, you want to try to hold for at least 30 seconds, if not longer, even up to a minute if you're able to tolerate it. Technique number 2, weight bearing. Weight bearing is actually a form of prolonged stretching with some added benefits, including strengthening and retraining proprioception, or your ability to tell where your body is in space, which can sometimes be impacted after a stroke as well. When you bear weight through your arms and your legs, the stress that you put on your muscles and bones helps to build strength, but it also helps to remind your brain, like, hey, my limbs are still here. It's a great way to help rebuild that brain-body connection. And because it is a form of prolonged stretching, you also get all of the benefits that I talked about in that first section. Technique number 3, positioning. Doing exercises and stretches is really important to help reduce spasticity. But what you do when you're resting in between exercises is just as important. When we think about, let's say, for example, upper extremity spasticity, arm spasticity, what we usually see is that arm is tight against the body. The elbow is bent, the wrist is bent, and the fingers are all curled or clenched into a fist. So what we want to do is make sure that as you're positioned throughout the day, we're fighting all of those movements to get the arm away from the body, the elbow straight, and the hand opened as much as possible. And there are a few simple ways that you can address this. So if your hand tends to curl up, but you still have movement there, whether you can passively or actively move your fingers, keep a washcloth or a wiffle ball in your hand to make sure that those fingers stay out and away from your fist. You also want to make sure that you're keeping your arm away from your body. And you can simply do this by using a firm pillow in between your trunk and your arm to widen that space. And same with your elbow. If it tends to be really tight, getting a firm pillow in there just to help open that space up a little bit can be really helpful. If you deal with calf muscle spasticity, do what you can to try to get your foot flat on the floor so that you're keeping a mild stretch on your calf muscle. And here's the thing, you can also talk to your doctor or your therapist if you're still in therapy to see if splinting or bracing is a good choice for you. Now, it's not right for everybody. If you still have some movement, oftentimes we discourage splint or brace wearing during the day because we want you to be actively moving your affected limb as much as possible. So it's going to depend on your individual situation, and that's something that you need to ask your doctor about. Technique number 4, reciprocal motion. These exercises allow you to move your limbs simultaneously so that you have the opportunity to use those muscles, not lose them. These reciprocal exercises can help with your coordination and also keep your spastic muscles moving so that we're strengthening both sides at the same time. And this is really important when it comes to helping reduce spasticity. Now for legs, you can do marching, and you can make modifications and adaptations based on where you're at in your recovery. So you can do seated marching, you can do standing marching. You can also do basic walking if you're able to actually get up and take some steps. You can do arm swings, and this is something that you can do while you're seated, or you can do it standing up if you want to get some weight bearing through your legs as well. You can also do alternating punches if you have a little bit of movement in your affected arm. And just remember, it's okay if you don't get full range of motion with each of these exercises. The goal is to keep those spastic muscles, those affected limbs, moving as much as possible. Technique number 5, everyday tasks. Managing your spasticity isn't just about stretches and exercises. It's about functionally using your affected side in everyday activities. Because the principles of neuroplasticity apply to spasticity too. You have to use those affected muscles so you don't lose them to atrophy, weakness, or contractures. Because the less that you use them, the more contracted and painful they will get. And here's the thing, if you can't use your affected limbs completely or have full range of motion, that's absolutely okay. You just want to try to move them as much as you possibly can. Let's say that you want to open a jar or a can, but you're not able to do so with your affected arm and hand. But you can use that side to help stabilize the jar or can. You can also use your affected arm and hand to turn off and on a light switch, whether you're just using your forearm or elbow, or you're actually able to get some wrist and finger movement. You can practice opening and closing doors with your affected arm and hand. Now, when it comes to each of these techniques, there are several mistakes that I see people making that actually increase spasticity instead of decrease it. And the first is forcing stretches. So spasticity happens because we have what's called an overactive spinal stretch reflex. Normally, this is a protective mechanism to keep the muscle from being overstretched, but instead it becomes overactive, and so those muscles contract, contract, contract. When you try to force a stretch, you're actively trying to overstretch those muscles, and so that reflex is just gonna kick in even more. On that same note, you wanna avoid quick stretching. Like I mentioned, spasticity is velocity dependent. That means it gets worse with quick stretching. So if you stretch really quick, you're actually gonna make the spasticity worse and not better. And the third is only resting the affected side. We have to keep those spastic muscles moving as much as is possible. Because what happens is, not only do we lose that functioning if we don't use it, it can actually get worse. And this is what happens when you rest too much and you don't move it. That spasticity ultimately can turn into a contracture, again, where those muscles and tendons become permanently shortened and you lose a lot of functionality. And the last mistake is ignoring pain. Now, it's probably expected to have some type of discomfort or even slight pain as you stretch a spastic muscle because they're tight, they're stiff, they're uncomfortable. If you have sharp pain that jumps out at you out of nowhere, you need to stop. And of course, you always need to make sure that any new stretches and any new exercises is right for you by checking with your doctor or therapist. While spasticity might always be part of your recovery journey, using these techniques can help to reduce its impact, help you stay functional, and prevent contractures. And make sure that you check out my Spasticity After Stroke playlist for more exercises and stretches that you can do at home. Please make sure to support the channel however you can. Like this video, subscribe, become a channel member by clicking the join button, or leave us a super thanks by clicking in the YouTube bar below. Leave me a comment and let me know what's been most helpful for your spasticity, whether it's stretching, exercises, medications, or Botox injections. And of course, a huge thank you to all of the donors who make this nonprofit possible, with a special thank you to Heather G, Ryan D, Modus Nova, and Joseph N, and our Empower tier on Patreon. Thank you all so much for watching. I'll see you next time.